Hello, everyone. We're going to get started with our Medicare update. I know we have some more people coming in a little later. Thank you for those who may be online. Thank you for joining us. And if you do have any questions and you're online, feel free to text your information in, and we will pass the information on to Pat Mayfield so she can answer your questions. But let us start with a word of prayer. Dear Heavenly Father, we thank you, Father God, for this opportunity to come out and receive the blessings that you have in store for us today through Pat Mayfield and her ministry in the Medicare, making sure everyone has the right Medicare insurance for their needs. And we're grateful that she has agreed to do this for us. And we pray that all those who are on their way, that they have safe travels here and safe travels back home. We thank you, Lord, for this opportunity to be a blessing to the community and all your people around the world, all those who may be even looking or go back and look at this. In Jesus' holy name we pray. Amen.
Amen. God is great and greatly to be praised. Okay, well, my name is Pat Mayfield. This is kind of my second installment with you all. I was with you a few weeks back, and we just kind of talked in general about Medicare and that kind of thing. One of the things that they require that I do every time I talk about Medicare is talk about, you know, the enrollment periods and all that stuff that we talked about before, but I may have some new folks, so I want to help them to understand how all of that works too. We're going to specifically zero in on one company this time. I was speaking with Melanie about possibly kind of coming back, you know, maybe in a couple of weeks or a week or so, a couple of weeks to give everybody time to, if you want to speak specifically about another company and then specifically about another. I have been in the business for over 30 years, and I am actually appointed with all of the companies. So every Medicare Advantage company that's offered in this area, I'm appointed with. And there are 8 of them with over 80 plans. So you just have an opportunity to be able to do that. One of them is actually, I'm also appointed with all of the prescription drug only plans. So if you're on just a prescription drug plan and nothing else, we can also talk about those too. So I just wanted to kind of make you aware that we're going to zero in on Anthem, because one of the things that I like to do is to make sure that people understand how these plans work. I think what happens is someone comes to your house, or you go to their office, or you go to some table at Kroger, or, you know, and they want to talk to you about these plans and that kind of thing. And a lot of times, even if you have one, you don't always understand how that plan works, okay? Because an agent is kind of going through pretty quickly and sharing information, said this is it, this is that. What I want you to be able to do, and what I want you to get from this today, is what questions to ask. And as you're talking to these folk, and I hope that I'm the folk that you're talking to, but as you're talking to folks, right, that you know what questions to ask and you know what things to look at. Because I think that, you know, a lot of times people says, well, I want the cheapest plan. Okay, well, most of the Medicare Advantage plans in our area are zero anyway, so you pretty much hit that one on the head, right? But in addition to that, somebody says, well, I want to pay the lowest deductible. Well, okay, some have deductibles, some don't. So the thing I want you to be able to pay attention to is, write this down, premium, of course, if you indeed, here's some paper here if you want to kind of write on this. Premium, I want you to look at deductible. We're going to talk about that. I want you to look at what's called the maximum out of pocket for these plans. That's my cheering section right there. I want you to look at co-pays, because that's important, right? If you have one plan where the doctor is only going to charge, you don't have to pay a copay at all, it's a zero copay, and then you go to another and it's going to cost you $15, that's important information to know. So copays are very important. Your prescription drugs, look up make that agent sit there and pull up every one of your medications in that plan. And then lastly, all of your doctors, I'm sorry. Your providers, sorry. Your providers. So I just want to make sure those are things I want you to be paying attention to, right? Because that's important to know as we go through this. Okay, well, Trina, can you go to the next slide for me? While she's switching me over, one of the things, it says local market, personalized service and all that. You get a lot of calls from a lot of people when you're eligible for Medicare. They start calling you 6 months before you turn 65, and they don't stop calling you until after you buried in the grave, right? Because they're calling you all the way up until that time. And so it is important to understand you're going to get these calls all the time. Some of them are calling because they really do care, I got to say. There may be some. But then there are others that are just looking for an opportunity. And so you got to know what questions to ask. And number one is, what is your name? If they're calling you on the phone, ask for a name. The other thing you can ask for is what's called the national producer number. Every one of us have to have one. That's our agent number. That's what we've been given as an authorized agent to sell these plans. They should have both. If they say, well, I don't have to have one, well, then you might want to tell them, it was very nice talking to you today, but I'll talk to you another day. Or I'll talk to an agent that actually has one. Okay? So those are things that when you're talking with people that you really honestly need to know. Okay? All right. Well, today's agenda, Medicare overview. I know we did that before, but let's talk about it again just so we understand where we are. So you know what choices and plan coverage you have. We're going to talk specifically today. Did you want me to take that? Okay. We're going to talk today about plan choices so that you can understand. And we're going to specifically talk about Anthem. I'll tell you, when I was going out and trying to get the information for which plans would be ready for me today to be able to talk to you, Anthem was the one that goes, oh, we got all this stuff. You want some supplies? We got that, you know. So they're the ones that were all ready to go. But I'll also tell you, these plans have a lot of different benefits, okay? So Medicare Advantage plans, we're going to talk about it in just a moment. As you already know, they have extra benefits other than just what Part A has, which is for hospitalization, skilled facility, hospice. Part B, outpatient services, your physicians, those services for Part B. Medicare Advantage has both of those, but in addition to it, they have hearing, dental, vision benefits, and that's kind of the enticing thing that some of these companies use to get you to consider their particular plan. Some plans actually have healthy groceries benefits, right? Some plans have what's called the personal emergency response system, you know, the lifeline, I've fallen, and somebody got to help me up, that one, right? So some have those. Some have more than others. And so what I want you to understand is there's some plans that have all of that stuff and some plans that have none of it, okay? One of the things I'll tell you is that Anthem is one of the companies that in one or two or three of their plans, they have all of those things, okay? And so I picked this so you can understand the kinds of questions to ask when you're talking about your plans. Okay, of course, their plans and then what's next. Can you click me over there, Trina? Okay, let's understand Medicare enrollment and eligibility. Click me over again. All right, so in order to be eligible, you all already know this, but let's just say in case you have a friend that may not understand how to be eligible, you have to be a permanent U.S. resident or a legal citizen that's lived here for 5 years in a row. You couldn't have just lived here for 5 years. You came here for 2 years, went back home for a few years, came back again. That starts over. 5 years in a row you have to be here, okay? You or your spouse must have worked and paid Social Security taxes for at least 10 years. 40 quarters is what they call it, okay? And you're at least 65 years old, or you could be under 65 and have a disability, okay? And so if you're eligible for Social Security disability and you have been on that disability with Social Security for at least 24 months, you're then eligible for Medicare. So you may have some friends that, well, I'm on Social Security disability, but they told me I'm not eligible for Medicare. Well, that's why, because you have to be on it for 24 months if it's a Social Security disability deal. Okay. You may also be eligible for dual special needs plan. Thank you, no problem. No, that's so you can go right on to the next screen. Okay, so there are several enrollment periods. There's an initial enrollment period. There is a special enrollment period. There's an annual enrollment period. There's an open enrollment period. 4 different periods, okay? And those are all opportunities for you to be able to switch your plans, okay? And I think a lot of times we know about the initial one when we first turn 65, right? Because everybody and his mama calling you. So you're like, okay, it must be time for me to get Medicare because everybody's calling, right? But a lot of times you don't know that there are other enrollment periods out there like special and open. And like I said, we talked about it before, but just to make you aware of it again. Your initial enrollment period is that period that's 3 months before your 65th birthday, the month of your 65th birthday that you can enroll in these plans, and then 3 months after. So let's say you turn 65 and you didn't realize, oh my God, I need to do this Medicare thing. I need to get a Medicare prescription drug plan, right? You still have 3 months after you turn 65 to enroll. After that, however, because you were then eligible to enroll, if you don't enroll at that time, then you may be subject to a penalty, okay, because you didn't enroll at the time that you were originally eligible. So if you know people that are missing these enrollment periods, please talk to them and let them know. Okay, next slide, please. Sure. Aha. Good question, Melanie. I love it. And you guys can stop me and ask the question as we get to those parts.
Please repeat the question so the people online can hear.
I sure will, Trina. Just a moment. This is it. What if you're still working? What happens then? Okay. So if you're still working, you've just turned 65 or you're getting ready to turn 65, you got in the mail your Medicare card. They're going to send it to you, right? Because they want to make sure that you get your Medicare card at the time that you turn 65. However, if you're still working, you're in an employer plan, so that is considered credible coverage. And what that means is that coverage is sufficient for you to have to not have to enroll in Medicare Part B. Because with your, I'm sorry, hold on for 1 second. So what's happening is, because you have that coverage, you don't need to have 2 coverages to cover outpatient kinds of visits and that kind of thing. So that's what happens there. So you do not have to enroll. However, when it's time for you to retire from that company or you're getting ready to leave that company, I tell individuals to actually start preparing for that 3 months before you leave, because it takes Social Security and Medicare a few months, like sometimes 45 days, to get you on your Part B plan at that moment, okay? So it's really important that 3 months before you're getting ready to leave, to start preparing. Call Social Security and say, look, I've been working, I'm getting ready to retire, I'll be retiring in three months, I need to know what to do. and they will get you straight, okay? So you're no longer, you don't have to pay a penalty or anything for that, because that's creditable. That's what they say. Creditable coverage means you don't have to pay a penalty because you have coverage that the government says deems okay to be able to have. Now, there are some people that have something that's called short-term medical plans, right? So they may get in one of those plans, or a hospital indemnity plan that pays you $500 a day for the next 35 days, that kind of thing, right? Those are not considered credible coverage, okay? So it has to be an employer plan, okay, so you can make sure that you're eligible for that. Hold on for 1 second. Go ahead, sir. Oh, she has a. Do you have the red mic on? Try it now. I think it's on.
Testing.
Yeah.
I think we got it. I consider myself having a strange situation. Being
Okay.
retired from both federal and state services and working, I did not accept the plan from them. Am I doing myself a disservice?
So did you all, you think they heard the question online? So I want to make sure I clarify here. So you are retired from the federal and from the state, and you're still working, and you didn't accept the employer plan that you're on now.
Exactly.
Okay, so what do you actually have right now? I know you have Medicare Part A.
B and a C.
Well, you know what? You're covered, but let's talk about that again. So you are covered, because what they're saying is that you have to have, the real deal is that you have to have a prescription drug plan. That's what the deal is. You have to have a prescription drug plan when you turn 65, okay? And if you do not have one, if it's through an employer, that's great. That's wonderful. They're okay with that. If you didn't accept the plan and you're on a Part C plan, that plan has a Part D or prescription drug benefit within it, okay? So you're covered. You're okay. But if you are 65, you're 65, you've got Medicare Part A, you didn't get Medicare Part B, and you don't have a prescription drug plan, we really need to talk, okay? Because that'll put you in a position where you may end up having to pay a penalty. So thank you. That was a great question, Melanie. Great question. Okay, so let's go to the next slide. Choices and coverage. Okay, so we just talked about that. Well, let me do this because it looks like it kind of skipped a couple of things there. All right, so there are different enrollment periods. Okay, great. Oh, it's working? Beautiful, fantastic. Okay, so the enrollment periods, let's talk about it. So I told you the initial one. There's an annual enrollment period. That's where we are right now, right? October 15th through December 7th, okay? And so one of the things I want you to understand about the annual enrollment period, this is a time where you can look at plans, make changes, switch to something else, stay with the one you have, stay with the one you love already. You know, you can do all that, right? This is the thing I want you to understand. The very last plan that you enroll in by December 7th is the plan you will be in January 1. So let's say someone called you yesterday on October 15th, because they had 35 calls going out yesterday to everybody. Everybody at least got 35 calls yesterday. So let's say you did that, and the person says, hey, I think you ought to be in this plan. This is the one for you. I think this is the one. You need to enroll in this plan. And you give that person permission to enroll you in that plan. The next day you go, God, why did I enroll in that plan? What was wrong with me? On the 15th, I don't have to enroll in any plan. It's the first day, right? And you go, man, and so you have like this buyer's remorse, not sure if that was the right thing. One thing you can do is call me, we'll talk about it. But the other thing is, let's say you decide, nope, I don't want that plan anymore. Do you know you can enroll in another plan? And that plan is going to kick the one that you just enrolled in out. So you have until December 7th to enroll. Once you get to December 7th, whatever plan you enroll in, the very last plan, is going to be your plan for 2025. Okay, so that's great. That's wonderful. So that's the annual enrollment period. Now, the open enrollment period. That's the period between January and March of each year. Now, with the open enrollment period, that is one where, let's say you were in a Medicare Advantage plan. You enrolled, you thought everything was okay. Remember I told you about checking your docs, your providers? That's really the better way to say it, not docs. Okay, the providers. I told you to check your providers. Let's say you didn't do it because, oh, you know, this was a great plan. They have all these benefits. I'm going to get in there. But your doctor is not in the plan. In January, you have another opportunity to switch. So you can switch to another plan that has your doctors in it, okay? What Medicare is trying to do is make it easier for you to not get stuck, okay? Because there's so many people out there that's trying to get you in plans, and they're trying to rush you through it, and then you don't even know what's going on, right? And so it is key that you understand you have another opportunity. But that's your last one for January, February, and March. You can only do one. Remember, I told you can do as many as you want to it in the annual enrollment period, but in that open enrollment period, it's one. The other thing is an agent cannot contact you. So let's say you enroll in a plan, and agent says, well, how are things going? It says, it's going good. Can you give me a call? Because I want to talk to you about this plan that I'm in, and I don't like it. No, the agent can't contact you. You have to contact them and say, hey, I want to make a change. So know that. So if agents are contacting you saying, do you want to change? Do you want to change in January through March? What are the two things I want you to get from that agent? The name and the national producer number, okay? Because they are not supposed to do that. And I think if we can kind of nip this thing in the bud as we go, then more seniors would feel more comfortable that people are really kind of looking out for their best interest. So just want to make sure you know that. And lastly, special enrollment period. So there are special circumstances in which you can enroll in a plan that's outside of the annual enrollment, outside of the open enrollment. Like, let's say you move from one zip code to another. I think I talked about that the last time. And I actually had a person who was listening online that heard that and called me the next day. Say, hey, I just moved about a month ago. So can I switch plans now? Oh, absolutely. You have 63 days from the date that you move to switch to another plan. So you can use moving as an opportunity. There are people that during the pandemic, they were on Medicaid, right? And so in being on Medicaid, now social services is kind of looking at everybody and saying, well, you were on Medicaid about 4 years ago, but we switched that thing now. And so you're no longer on Medicaid. And so that opens up another opportunity for you to be able to switch plans. You see that? So you have a lot of opportunities to be able to do that. Yes, ma'am. Yes, it does. And so that's the reason we have to ask your zip code, because it's all zip code based, and that's the reason you're able to switch, because you're changing zip codes. There may be a plan in Virginia that's not offered in Maryland, for example, or not offered in Florida. So yeah, absolutely. Yes, absolutely. You got it. That's it. So her question was, does it vary from state to state? And yes, it does. That's why you have to have your zip code. Yes, ma'am.
Can you kind of clarify which you meant? You said Medicaid can drop you or something?
Well,
What does
okay,
it mean?
because
I mean,
Medicaid, she asked the question, can you clarify that Medicaid could drop you? I guess I could have said a little bit better than that. Okay, terminate maybe. But anyway, so what happens with Medicaid is actually income-based. So one of the reasons that people were eligible for Medicaid during the pandemic, when they weren't eligible before that, was because during the pandemic, they raised the income that you can make, whatever your Social Security is, if you're working a job, how much you could make. And based on that, they allowed you to also get Medicaid, okay? Once the pandemic ended, they reduced that amount, okay? So it went back to pre-pandemic numbers, not totally, but mostly. And so those individuals that were on it as a result of that, now they are not able to continue on Medicaid. So then they'll say, okay, now this opens up an opportunity for you to have a special enrollment. Okay. Yes, sir.
I have a question. There was a thing when my wife had surgery at a hospital, and then she called back up to check because she wanted the doctor to check her.
Right.
Then they say, well, we don't take your insurance no more,
Okay.
and it's Medicaid. But what type of Medicaid? So how do I know? And this is in a different state.
Okay.
How do I call that hospital to find out which one they're on?
Yeah, yeah and no. So this is the thing, in order to find out whether the hospital is in network or not, is to call Medicaid. So you've got to call whatever company. So let's say that Anthem, for example, is your Medicaid.
We're in Aetna.
You're in Aetna. Okay, there you go. Good one. So let's say you're in the Aetna plan, and you want to find out whether that hospital, that doctor, or whatever is in network. You can actually call member services, and they'll be able to tell you that. And they'll be able to tell you before you go there. Now, let me share something with you. Let's say something happens and it's an emergency situation, right? And so now you've got to go, you're gone to the hospital, and normally this particular hospital is not in your network because they don't take bon secours. They only do HCA folk, right? And so you've gone there, and now you're concerned because you're going to have to pay. The reality is, under emergency situations, everybody's in network. Now, they're going to move you to wherever they need to move you once they get you stable and ready to go. But don't be afraid to go to the hospital when you need to go to the hospital, okay?
So could I call up the particular hospital and find out what they have?
You can. Yes, you can. I'll tell you that sometimes, kind of the same thing with doctor's offices, you may call to see if they're in network, and if you don't give them the exact title of your plan, because a lot of these hospitals and doctors may accept the Aetna plan, Aetna Medicare value plan, for example. And y'all had me talking about Aetna, and this is an Anthem, Anthem Medicare value plan, right? However, this hospital only accepts the Anthem plans that are on the marketplace, but may not accept the Medicare plan. So you're better off calling the member services to find out if it is. But yes, you could call the hospital. You got to make sure you're giving them the right name of your plan, though, okay? Because if you say I'm in Anthem and you're in Aetna, no, I'm joking. You say I'm in Anthem and you just give them that, that's not enough for them to be able to give you the correct answer. And it is on your card. The member services number is on your card. Okay. All right. Any more questions? All right. Yes.
Please make sure you speak into the mic.
His question was, do they give you any other cards other than paper cards? Most of the cards have like a plastic coating on them, but are you talking about Medicare, the red, white, and blue card? Oh, no, look, let me share something else with you that's going around, and be very careful with this. There are individuals calling around saying, hey, Medicare is trying to update your card. And as a result of that, we want to let you know, have you received your new plastic Medicare card yet? Right. Medicare is not doing that. I'm just saying, be careful with stuff like that, okay? And then, so let me tell you something. I got to tell you all the truth. Remember, I've been in this business for 30 years. So that must mean I'm 65 somewhere, okay? So I'm just telling you. So for 2 weeks in a row, I was getting those calls. I was getting a call, right? And I said, what? Wait a minute. Medicare is sending out plastic cards? Really? And then she says, oh, yes, ma'am, have you gotten yours? I says, when did they decide to do that? And then she said, ma'am, I just wanted to make sure that you got it. I said, why are they doing it? She says, ma'am, it's just my job just to make sure, I want to make sure I have all your information. So I said, they are not doing it. Do not call me again. Called me again 2 weeks later. Same thing. So do not, look, I'm saying if Medicare is doing that, call Medicare directly and say, hey, did you send me a new plastic card? So they're finding anything that they can to try to get in to get your information. So just be very, 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 very careful. Okay. Yeah, oh yeah, yeah. Oh my goodness, you're exactly right. And I think that that's what was happening with her. She ended up hanging up in my face. And I was like, okay, good, that's what we want. All right, let's see. All right, choices in a plan. All right, so we know about Part A and Part B. I think we've talked about that before. Of course, you have to have Part D. So the requirement is A, B, and D. You had a question? No, they can't hear you online, though. Hold on one second.
Before I had the Medicare card and the Aetna card, and now I've got just
Talking to me about it.
sorry, just the Medicare PPO from Aetna.
Okay,
This is the only card they need. When I give it to them, that's it.
that's correct.
But that is only every doctor that you go to have to be in this plan, because now you're not in Medicaid. So how did they get paid by Medicaid?
Okay, so let's do this. Let's understand how the Medicare Advantage plan works. So the way that it works is A and B is original Medicare.
Right.
That's the federal government, right? Part C are private companies that have been designed to assist you with your Medicare administration. So what happens is that $174 Part B premium that's coming out of your Social Security check every month, right? What they're doing is if you pick Anthem as your as your Medicare plan, right? If you pick Anthem as your Medicare plan, then the government is saying, or original Medicare is saying, hey, he decided he wanted to let Anthem administer his Medicare. So we're going to take that $174 that's coming out of your check every month, and they're going to send it over to Anthem. Now Anthem is in charge of all of your Medicare. So that's how they're being paid, right? The $174 that you would normally pay to Medicare for your Part B services is going over to that insurance company. Now, as far as PPOs are concerned and HMOs, PPOs are plans that you can go in and out of network. So you could be seeing an out-of-network doctor, right? So this doctor may not be in that plan's network. You say, okay, I want to go see Dr. Green, but Dr. Red is like in your network. You go see Dr. Green. Because you're in a PPO, you can go to Dr. Green. You're just going to pay more for your services to Dr. Green because he's out of network. With an HMO, on the other hand, you can only see doctors in your network. So you can only see Dr. Red. Can't go to Dr. Green. If you go to Dr. Green, then you're going to pay for that in full.
Okay, but the PPO, okay, since it's going to cost more, do you have to pay out of pocket, or they will take care of it?
You're paying out of pocket that which costs more. That's correct.
Extra.
That's correct. You're going to be paying for that.
But we didn't ask for this. They automatically.
Uh-oh.
No, I will tell you how that happened.
Okay, well, what we could, let me take, because I want to make sure I get to everybody and get through this presentation, then we can kind of talk again. Okay. Talk to me a little bit after, because we can kind of talk about that, because it sounds like, you know, let's just talk. Okay? Let's just have a discussion.
Those are the things that happen.
Exactly, and especially if you enroll, if you actually enroll with someone on the phone sometimes, because you're not looking at it. You're talking, you're hearing what they have to say, and most of us are, we got to see what's going on. You tell me A, I need to see is A, right? And I think that a lot of times when we're enrolling on the phone, we don't really realize that's what's going on. Okay, so Part C plans has A, B, and a prescription drug plan in it, right? All right. Part D, you can have that by itself, because there are some people that have Medicare supplements, right? So they decide, look, I don't want to do this Advantage thing that people be talking about. I'm going to do a Medicare supplement. The way supplements work is you have original Medicare, Part A and B. That's 80% of the cost is being paid there. You have 20% that's left. Okay, I need to get something that's going to cover that 20%, because I'm not trying to pay 20% of $40,000. Ain't going to happen, right? So you get a Medicare supplement to cover that percentage, okay? And then in addition to that, you have to have a prescription drug plan. Everybody has to have a prescription drug plan. Everybody doesn't have to have a supplement. And everybody doesn't have to have a Medicare Advantage plan. You understand? Because the only thing you have to have is A and B and a prescription drug plan. Those are the requirements. But the reason you get some of the other plans is the 20% that Medicare doesn't pay, you get a supplement. The prescription drug part that original Medicare doesn't pay, right? The Medicare Advantage plan you get because it has a lot of other benefits, and they may be benefits that would be something that you want, right? So you may be looking, I need a dental plan, but you don't want one outside. If you get it in a Medicare Advantage plan, they have dental, vision, and hearing. And then, of course, I mentioned to you the supplement plans that pay the 20%. Okay, let's see what we got. Okay, now look, I think I talked to you a little bit about this the first time. Now they have it. Now it's official. I can talk to you about it. So most Part D plans, whether we're talking in a Medicare Advantage plan or we're talking a regular prescription drug plan, right? All of them have three coverage periods. The first period is the deductible period. And what that is, that's the period where you have to pay all of the cost of your prescription drugs until you reach whatever the deductible is. So let's say this is a plan that has a $500 deductible. Then you're going to pay everything up to that $500 deductible. Once you pay that, you move to the initial coverage. But let's talk about that for a minute. Not all plans have deductibles in 2024. Most plans have deductibles in 2025, okay? So in 2024, a lot of people could go ahead on and get their prescriptions, not worry about paying for the full amount till we get to $500. In 2025, that has changed a little bit, okay? All right, so that's what happens. Now, we go to the initial coverage phase. Now, that's the phase where the $500 or $150 or $220 or $350 or $360, I'm calling out all those numbers because there you go with those deductibles, okay, depending on the plan that you're in. Once you've paid that, you move into the initial phase. Now, in the initial phase, you pay, and whatever third party that you may have, like you may have, let's say you have Medicaid. Medicaid may be assisting you with paying for your prescription drugs. Or you have extra help, okay? Extra help is a program that's initiated by the federal government for individuals that are on certain income levels. They qualify for extra help for paying for their prescriptions, paying for their deductibles, paying for their premiums. So people qualify for that. Now, one of the things that I'm doing with all of my clients this year is we're going to apply for extra help. Just to see, because you never know, you may qualify for extra help. Today, I'm going to tell you what the website is. I think I did last time, but I'm telling you again today so that you know where to go in order to apply for extra help. But anyway, it doesn't matter what your costs are. Once you reach $2,000 in out-of-pocket costs for your prescription drugs, you are done for the year. You have no more copays. It is zero for the rest. You're smooth sailing for the rest of the year. And that's when we get to the catastrophic phase where you don't have any more copays. Now, this year, and I might have mentioned this a little bit the last time, in 2024, they have like what's called the coverage gap. People that have, a lot of prescriptions, tier 3, brand name medications, Ozempic, Farxiga, all those guys. Those individuals may be paying a lot in the coverage gap, right? And generally, once you get in the coverage gap, that's up to $8,000 you're responsible for, along with the pharmaceutical company. Well, like I told you, for 2025, it's $2,000. That's it. It's over after that. Now, one of the things I want to share with you, because I can't do detail of it because it would just be too much. We'd have to do too much math in here, and not very good at the math thing. But what happens is, this year they have a couple of ways for people that have a lot of, let's say you have a lot of tier 3 medications or brand name medications, and you would end up having to pay a lot in, let's say, okay, so there are some plans where there's a 20% co-insurance for prescription drugs on the tier 3 level. So let's say it's a $1,000 medication, and that would mean $200 you would have to pay. Okay, so if you had a $200 copay for a medication, you would have to go 200 times 10 months before you get to $2,000. You see that? Right? Okay. So what happens is they have come up with, the federal government has come up with, or CMS has come up with what's called the Medicare Prescription Payment Plan. I'm telling you that so that you know that you can call your insurance company, whichever one you decide to go with for 2025, and they will put you in touch with the people that can assist you. The way that they do that is they have what's called a smoothie. They're calling it a smoothie payment, which means you're paying the same amount throughout the year till you get to the $2,000, right? And so they're able to make arrangements for you to be able to do that. And so when you go to, let's say you have 4 medications, 2 of them are tier 3 medications, right? So that means if you had 2 tier 3 medications that were $200 each, that would be $400 a month, right? It would take 5 months to get there. But with the Medicare prescription payment program, you would not be paying $400 a month. They will make arrangements with you based on looking at all the prescriptions that you're taking, and they will smooth that out over the year. So it may be significantly less than that amount. That's why you really have to, if you're taking a lot of medications, which is the new thing I just told you. So I told you need to know the guy's name, you need to know the national producer number, you need to let them know what your medications are, because that agent can tell you what your position is with that, okay? So it's key. If that agent's not asking about your prescriptions, not a good thing, because you want to be in a position where you're not stuck with paying $500 a month for medications, and you don't have to, okay? All right. All-in-one Medicare Advantage. So, of course, you see Anthem have their card. What will happen is all of that, wrong way. Let's go back this way. Okay, that's it. Okay, well, let's do this. So, review your options. We'll do that. You complete your application. They have a get-ready guide. You'll get your approval letter from them or whatever company you're enrolling with. You get a welcome email and a welcome letter from these companies, okay? Generally, you're going to get the welcome letter within 10 days of having your card and your welcome materials within 10 days. If it's past 10 days, then you may want to contact that company to make sure that everything is okay. And this should be no problem. We're in annual enrollment. Okay, you can go online to find your doctor or pharmacy and manage your medications. And by that I mean you need to find out before you enroll that your doctors are in that plan. Any agent can check it for you. You can do it yourself even, okay? And is that the end? Way to go. Okay, hey, Trina, are you able to put the information on there for me? I'll kind of walk you through. One of the things that I wanted to be able to do, she's good, y'all. I'm going to tell you right now. One of the things I wanted to be able to do today was to help you to understand how going to Medicare.gov can help you to understand which plan works for you. Because a lot of times people will be telling you all this ridiculousness, and you are not sure which way you should go. You can always go to Medicare.gov and find your information. Okay, so let's do it. Click Find Plans there, Trina. Wonderful. So you're going to get to this page, and you're going to click on 2025. It's already there for you. Let's put in the zip code for the church. 23224. Yep. You can pick Chesterfield or Richmond. It doesn't matter. Continue. All right. Medicare Advantage Plan Part C. That's what we're going to look at, right? Pull it up for me. Trina, you are good.
Hold on, because I can't see that.
Oh, you can't. Okay, it's all the way at the top.
Am I getting close?
You're there, almost. There you go. You are good. Find plans. Beautiful. Now, this is the other thing that you have to look at. If you're on Medicaid, you would click Medicaid, which is the first one. If you're on Social Security, supplemental Social Security income, you would click that. If you're on a Medicare savings program, you would click that. If you're getting extra help, click that. But what we're going to do today is, can you scroll up a little bit? We're going all the way to the bottom, and we're going to click I don't get help from any of these folk. There you go. Love it. All right, so do you want to see drug costs when you compare plans? Now, let me tell you something. Here, the question is going to be yes. Answer is yes for you. So what you would do is, but I don't want you to click yes. I want to go straight to the plans. Click yes, especially if you're sitting with an agent, make sure you do it. If you're doing it on Medicare.gov, also go ahead on and put your prescriptions in. I know, some of those prescriptions and the way that they're spelled, and oh my Lord, help us. That's why I exist. You can give us a call. I'll be more than happy to check that for you. But this is just in case you want to do it yourself, because where I am is I want people to really understand and know this, okay? Because you get so many calls, and I think if you know this, you're in good shape. All right, no. Can you click the no for me, Trina? Do you want to see your drug costs when you compare plans? No, not right now. Are you sure? Because they want to make sure. All right, nope, come on down and click next.
There you go.
All the way down. Come on, there you go, right there. Trina, you're good. Okay, so look at this, y'all. So scroll up, Trina. There are 40 Medicare Advantage plans on Medicare.gov. You see, there are the Aetna plans, there's Cigna, keep on going, keep it moving. There's United Healthcare. That's who that AARP is. There's Humana, keep on going. Because I ain't supposed to be talking about those folks. Okay, come all the way down, Trina, and hit, go back up and hit the next screen. It's number 2 down here, if you can see that. All right, right there. Almost, there you go. And so it's gonna scroll you back up. So keep on going, I want you to keep scrolling so they can see. All of the plans are there. There you go. Every one that you've ever seen. That's an interesting one right there. Keep going. All right, now click over to 3. All right, keep on going. See all of the, all right, now, let me see. Stop, no, keep going. Stop right there for me. Go up just a little bit, just a tad bit, just a little bit more. Right there where you see add to compare. So you see enroll, plan details, add to compare. Click on that for me. Is if you can get to it. You're good, Trina. Keep going. Okay. Scroll on some more. Scroll on. All right. Go down to number 4. It looks like all the anthem plans are on the back page. There you go. Click there. Okay. Keep it scrolling. I must have missed the anthem plans there. They were on page, all of them were on page 3? Okay. So I'm going to have you go back to page 3. That's why I need to have more than 4 eyes. I need at least 7. Okay. All right, now scroll up and see what you see. And if we don't see it, then we're just going to click on anthem plans, because that's the other thing you can do. If you wanted to focus on a particular company, you can just click on that. Keep going. Keep going. Keep going. We're not going to do the veteran. Keep on going. Okay. Keep on going. That's PPO. Keep going. We don't want that one. Keep going. Stop. We already did that one. Keep going. Huh. That's interesting, isn't it? Okay. All right. Back up. See how it is when you're doing it live like this on live.medicare.gov? All right, back up again. So go back up to the top, and let me see if I can find Anthem this way. All the way back up to the top, Trina. Okay, so insurance carrier is like, you see plan benefits, insurance carrier, drug coverage. Do the insurance carrier. Go over to the left, right there. Click. And come down. And the second one is Anthem. Let's see if it does it that way. There you go. Now come down and hit apply. Oh, see, after a while, Trina's going to have this thing. As a matter of fact, what she's going to do is say, look, Pat, you ain't even got to come back. I got it. Don't even come back. I got it now. Aha, that's a PPO. I don't know why none of the HMOs are showing up. They're all PPOs. Interesting. Well, then let's just look at this one then. We're going to look at that Anthem Extra Help one. Can you go over and click on Compare? Ooh. It may let me do it with one plan. It may not. It may let me just have to go on. Well, none of them are the best. It's based on what is right for you. Today I'm doing Anthem because they have they got their information to me so I could get it to you, so I could show you. Okay.
That's it, Anthem Extra Help.
It is, absolutely. Okay, do me a favor. Did you try clicking on Compare and see if it lets you do it? If it does, not that one, not the ad, all the way down over to the right. See if it lets you do it.
That?
If you're not really comparing, it may not let you. Okay, go back up to or down to the Anthem Extra Help. I'll just want to show you this one, and then I'll show you how this works, and then we'll go from there. Okay, so come all the way down. Come all the way down, almost there. Okay, so back up a little bit. I don't know why, where is my Anthem Extra Help that was up there at first?
I'm on page, what am I on?
I need at least 30 eyes helping me, at least. Okay. So, yeah.
Is that it?
No, that's not the one I want. That's not the one. Yeah. Can you go back to back to drug? No. So, see, that's the thing. That's what the purpose of the insurance carrier part. So you can click on that particular plan. For some reason, it's only showing those 3 plans, and Anthem actually has 10 or more plans in this area. Okay. All right. So.
Can we change location?
No, because it still should show up there with a 23224. Okay. Select plan type. It may have HMO under that. There you go. Let's see if we have it there. Then come down to apply. Because what I was trying to do was do it here so that the people online can see it. Because I have the books here that folk could go through, but I wanted to be able to do that. So see, it's not even showing that way. All right, so come all the way down, click out, exit out of this Anthem Help. Hit that X right there, all the way down. There it is. Yeah, just click that. Okay. And so, and then, you know, get out of the, hit the X for the HMO and the X for Anthem. So basically, at least I can tell you this part, that Medicare.gov is where you can go to pull this information, okay? To look at the different plans that are in your area. And it's not a lot to do. I mean, it seems like it because I was trying to work Trina through it, but it is not hard to do. The thing that I want you all to understand is it is important for you to know for yourself how these plans work. And I hope that at least a little bit that I shared with you today helped you to do that. Yes, ma'am. No, go ahead, please.
Here's Mike. In a trust fund to protect it from, and these people that I know have good insurance, but of course they know their circumstances better than myself, but they suggest that you put your home in a trust fund to protect it from being taken care of in case all your stuff not covered.
Yeah.
You know what I'm saying?
Yeah, I do.
I'm
And those are that's one of the things that I like to kind of talk off mic about.
Okay.
But yeah, what happens is generally your house is not the one that's included when they're looking at all that stuff, as long as there's someone still living, like a husband or a spouse or whatever. But yeah, I understand why they're doing it, because you're trying to spend down all of your assets so that you qualify for Medicaid to be able to get long-term care services in either a nursing home or skilled nursing facility or home health. And
So if you had long-term care, then you wouldn't really, may not really need it.
Right.
Okay.
Yeah.
Number two.
Yeah. Okay.
When you move, you touched on it.
Mm-hmm.
If you move, just say from one county to the other, do you need to report? And I know you need to change the address, but would you think that the prices would be different just within the same state?
Okay, well, yeah, within the same state, yes. I mean, there are different zip codes, but one of the things that I want you to know is that with a lot of these plans, would you pass out these books just for them to take a look at? With a lot of these plans, they actually have which counties are in, that this plan is actually in. So you can look at the book and say, well, okay, well, this plan is covered in 60 of the Virginia counties, right? So you don't necessarily have to make a change if your plan is still in whatever county that you were in, okay? But yeah, you definitely have to make a change for your address, period.
But it's in the same area plan, then you may not really change.
That's right. But look, this is what happens with that. And I'll just throw this one out there. Let's say you've moved from you've moved from Richmond to Goochland, for example, okay? So there may be plans that are offered in Richmond City that are not offered in Goochland. So the plan that you're in may not be offered in Goochland or Cumberland or Dinwiddie, although they're all close to Richmond. You know, you could throw rocks and hit each of these towns, right? But the problem is that carrier makes a decision whether they want to offer that plan in that particular area. Mm-hmm. Well, it depends on, so what you can do is put the zip code in, And whatever zip code you put in, those are the plans that are in that particular area. So if you know the zip code, if you're going to move to Cumberland, then you can put that zip code in there, and that'll tell you all the plans. Didn't work for us today. For some reason, it wasn't picking it up, but that's how that works. So you can do it. Yeah, absolutely. Now, I did that so that you guys will know how to do this. I mean, I have a lot of clients that say, well, Pat, isn't that why people pay you agents to do? Yeah, they do. But you at least are able to go and take a look for yourself, okay, to be able to see. I will tell you, I've had people that have gone online, and they've done it online. They made a decision on a plan, and what happened was they didn't understand all of the details of it, so they still had to see an agent so that they could understand what was going on. The whole purpose of this is to let you know that there are other options out there. Now, I would hope that you'd want to call us and we can help walk you through it. We would love to, but just to let you know that you have that option. You know, it would be so easy to say, hey, there are no other options. You can't do Medicare.gov. You gotta see me, right? I could tell you that, but that's not the truth. My job is to help you to find the plan that's right for you. And so if part of it is at least understanding before somebody comes in your house and talk to you about it, then at least you've understood before that. Okay? All right. Well, everybody, that is like pretty much it. The only thing I wanted to do was to have you turn to one page. And I'm sorry for the individuals that are online because some of the information that I sent to Trina were PDFs. She couldn't pull them up. So this information was actually in a PDF here. But what we're going to try to do is maybe the next time we do this to have it so that we can do that also. Okay? All right. But I want you to turn to a couple of pages in this book real quick, and then we will be done. Let me give you the page number. Hold on. Okay. I want you to turn to page... And I don't know if this is really a page here, but if you keep flipping through to benefits at a glance, it says our plan details, and then the next page says benefits at a glance. I think you've gone too far. So it's in the first section that says our plan details. Maybe kind of walk around and help them. You see it? Benefits at a glance. Keep going back all the way to the back. Keep on to the front. No, to the front, I'm sorry. Keep going. Keep on going. Almost there. So you see summary of the benefits over here. Keep going all the way. It should be plan details. Keep going. Keep on, almost there. It's right towards the beginning. And it says plan details. You're almost there. Keep going. Keep on going. Keep on. There it is. Benefits at a glance. Now, this is what I want to show you. For every single company out there, they have benefits at a glance that you can look at to basically see what's covered in that plan. Then you can move further where it has the summary of benefits that explains these benefits at a glance in more detail. Okay? So this is just to kind of give you an idea when you're looking at this particular plan. The things I want you to look at when you're looking at plans and talking with someone. The premium. Okay, so this one is 0. You want to look at the co-pays. So for each of the different visits for your doctors, for your physical therapy and all of that is listed at a glance. So for this plan, your primary doctor visit is 0. Your specialist is $25. It has a dental benefit, $2,000, right? 0 copay for preventive stuff. 0 copay for comprehensive. So it pays everything up to the $2,000. Once we hit $2,000, you're on your own. Yes, ma'am. Yes. And Anthem's network is the Liberty Dental Network. But once again, you can look up your dentist in that plan's network. Okay. Did y'all see I skipped over something? after the monthly plan premium, it says everyday option. Remember I told you that each of these plans have dental, vision, hearing, all that stuff, but it also has additional benefits. In this particular plan, they have the everyday options, which is an allowance for assistive devices, groceries, over-the-counter items, and you get an $80 per month benefit, okay? So this is one of the plans that has that grocery-type benefit in it, okay?
Excuse me.
Yes.
Which document are you on?
I'm looking at the one that is Medicare event,
The Medicare part?
Medicare comparisons. Do you see that?
Anthem comparison?
Uh-huh.
Okay, thank you.
Uh-oh, she may be trying to find stuff for me. I love it. Okay, the next benefit is a vision benefit, $200. Hearing, of course, up to $2,000. But Anthem also pays for over-the-counter stuff. So if you find an over-the-counter hearing aid program, they'll reimburse you up to $300 for over-the-counter. Because, sometimes, Miracle Ear or some of those others that are out there now. Transportation. Now, one of the things, too, with Anthem is if you're an individual who needs assistance with transportation, they're one of the plans that's still offering it. Some of the others are not. Okay, so, you may be in a Medicare Advantage plan and you were using transportation for 2024. In 2025, it's not. Yes, ma'am.
Now, I know there's transportation to medical appointments. What about emergency services if you need ambulance services? Do they cover that?
Yes, it does. Very good question. So as we go down, we'll get to that so you'll see what that one is. So, yes, it does. Ambulance services is $270 is the copay for the ambulance. Now, I remember a few years back, I had a client that I talked with, and we were going through the different plans. It wasn't this particular plan because this one just came out this year. But we were going through it, and I says, you know what? I'm excited to let you know that this plan has ambulance services, so ground transportation to get to the emergency room if you have to get there. But wait a minute, if you're out on the ocean and they need to fly you, it also covers flying, right? So that you can pay that $270 or $300 or $350, whatever it is for that plan, and they'll take you. You know what she told me? She says, Pat, thank you, and I'm going to get the plan for that very reason. Because this lady lives 1 block from Richmond Community Hospital, and it cost her $900 for the ambulance. Yes. And she said, I am not playing with her again. Trina, you are so good. Oh, my God, I love her. Okay, let's do it. Let's do this then, okay? All right, so the book that we're actually looking at is the Medicare Advantage 3. That's the one that we're looking at. But I want to, when you pull up this information on Medicare.gov, you can compare. When you click on compare, that one shows up. When you click up the grocery one, that one shows up. When you click on the extra help, that one. So you can compare, be looking at them side by side. Just like the Anthem ones, you can say, okay, I want to look at Anthem, I want to look at the green company, and I want to look at the gold company, right? And you can pull them side by side and compare like that. That's the beauty of this, okay? But it's even more beautiful. No, I'm just going to miss. I'm sorry. All right, let's go. Let's scroll up for me then. I love it. So this is what I really want you all to look at. Y'all can close the book now because this is the part I want you to see. And on Medicare.gov, it shows you side by side each of the plans, and it tells you what each of these plans cover. Okay? So, all of them cover vision, all cover dental, all cover hearing, all of the Anthem plans cover transportation. If you have some of the other companies up there, it will show an X, which said we don't cover transportation anymore. We used to like it too, but we don't do it anymore, but Anthem continued. We cover fitness benefits, so silver sneakers and that kind of stuff. So for those of you that are, fitness folk and you're keeping yourselves healthy, fitness is still in that plan. The plan is worldwide emergency. So if you're over in France and you get in an accident and you have to go to the emergency room, you're covered by your plan. But I'm telling you, they're going to try to hurry up and get you straight real quick and get you back over here to the United States, okay? But know that you're covered. Don't think, oh, my God, I just got hit by a car in France, and that's it, life is over. So it's not. Over-the-counter benefits. Each of their plans offer over-the-counter. Keep going. In-home support. Now, that's to have someone come in your home and to assist you. None of the plans cover that, except, let's say you go into the hospital, you had hip surgery, or you had knee surgery, you had surgery, and they've released you from the hospital, but you're not quite up to it at home. So they'll provide in-home support, like physical therapy, occupational therapy, someone to help bathe you and that kind of thing, in your home for a certain period of time. But your doctor has to say it's okay. All of this is doctor-based, right? So if he says you need it, then you can have it. If he says, I think she's going to be okay, then you won't have it. So it's really based on what your doctor says. Okay, beautiful. Look, she's taking me on up there. Health-related emergency response device. Remember I was telling you about the I fall and I can't get up deal? That one, the Medicare Advantage 3 plan does not offer it. The Anthem Grocery does not offer it anymore. Only the Extra Help plan offers it. Okay? So when I was telling you about the check, and the X, that lets you know, no matter what plan you pull up, it lets you know what they offer and they don't. All right, home and bathroom safety devices, all 3 plans offer. Meals for short duration, the first 2 don't offer that. The last one does, and that's the Extra Help plan. So, which is the reason I am also trying to get a lot of my clients to consider applying for Extra Help. It is not a lot off of it doesn't take a lot to do it. You just go to Medicare.gov, type in Extra Help in the search bar, and it'll pull it up. The application is very easy to complete. If you want me to assist you, give me a call. I'll be happy to do that. Okay, annual physical exams, of course, telehealth, endodontics, and periodontics. So what that does for you, and that's really what I wanted them to really see, is that for each plan, it tells you what they cover and what they don't. With the Anthem grocery plan, because I don't think they have it up here, each of these plans that have the grocery benefit, or they have, well, let me just say the grocery benefit. Most of these plans, you're going to have to qualify for it this year. Like last year, a lot of people got these grocery benefits by saying, I have diabetes. And by saying that, checking it off, saying I got it, that was enough. And they said, okay, as a result of that, we love you and we're going to send you a grocery card, okay? This year, you're going to kind of have to prove it. And the way you prove it, remember I was telling you about your doctor? He is the one, or she is the one. If she says, yes, this person does have diabetes or have a heart condition or have a pulmonary, COPD or whatever it is, if he does that and they're able to verify that, then you're eligible for the grocery card. So this year, anybody that's already in a plan that has a grocery card, the plan is going to look at your conditions, like they're going to look at your claims history to see if you've been treated for diabetes or if you're being treated for a heart condition or whatever it is, whether you're going to continue to have that card going forward, okay? Now, if they can't verify that by the end of December, then you may not be able to use it in January, but once they verify it, you'll be able to use it, you see? So they got to do the verifications. Each of these plans, as you're completing an application, there's a form at the end of that application that you just check off your information. It goes to the company. You don't have to do anything about it. Your doctor, once they send it to your doctor, he'll send it back in to say that you are or you aren't. And I think that's really basically all. Any more questions? Any online questions? They probably hung up like, you know what? This woman right here. No? Oh, yeah, we're gonna talk after. Okay, well, I hope. Oh, I have stuff over here. You guys grab stuff. Our cards are over there. We have a form that you can complete if you want me to get in touch with you to talk to you about it a little bit more, and everything. Look, I hope that I gave you at least enough information for you to understand that part of this, you can question yourself, right? You don't have to just accept what someone is saying just because they're saying it. I'm telling you, you look at the premium, which is probably zero. You look at the co-pays for your doctors. Some are zero, most of them are zero for primary, but some are 25, 35, 50, 45. You got to look at that stuff to see what it says for you. Some of them have the grocery benefit, $80, $45, $75, it just depends on the plan, and several have none, okay? So you got to look at it. Just because someone said has a grocery benefit, tell them to show you in black and white, okay? Say that again. Right. Yeah, and that's all, yeah, I know, and that's something that they will determine based on looking at your claims history and that kind of thing too. So it may. I can't say. I'm an insurance agent. A lot of times my clients think I'm a doctor too, but I try not to go that way. I don't have a degree. But yeah, so I hope that you at least understand a little bit more so that when someone is talking to you on the phone, honestly, I'm trying to combat those phone calls. That's what I'm trying to do. Don't let them do it. Don't let them just convince you that it's okay, and you don't have to make a decision that day. You do not. They say, well, we're already halfway. A client, I think, told Sharon the other day, well, I got all the way to, this particular partner says, look, I have an agent. I don't need to talk to you. Leave me alone. And then the guy says, look, we're halfway through the application now. What? Wait a minute. Through the application. You know what I'm saying? And didn't even know that he was applying. You see what I'm saying? Yes, ma'am. Hang up. Oh, okay, I'm sorry. Aha, that's a good one. And guess what? But this is the funny part. You get that number. She mentioned that she gets a number to call them back. You call that number back, they don't answer. Okay. Oh. Yeah. Yeah, and I just say it is so much better when you're look, this is the thing. This is what I would always tell my clients. Look, I'm sitting right in front of you. I'm at your table. We're going over. You're at my office. We're talking, right? You see me. You know where my office is. I'm in the same town with you. So if you have a problem with something that I've said, then you can call me back and say, look, I remember we were sitting at the table and we were talking and you said I was supposed to get whatever. Now, I ain't playing with you. I'm going to report you to Medicare because I don't like it, right? Because you see me. Those people on the phone, you can't report nobody. You don't have their name. Get that national producer number. I'm telling you, get it. They will hang up on you. They will hang up. If you ask for it, they're going to hang up because they don't want to tell you. Then they'll say things like, and I'll say this one last thing, and then because y'all know I can go. One last thing, and then I'm going to let you go. They'll say, look, no problem. You can always change it January 1. You don't have to worry about, I put you in this plan. Think about it while you're in the plan. You can change January 1. You call them back to change, nowhere to be found. Just be careful is all I say, okay? All right, thank you all. Say that again? Oh, yeah, accessible, where you're able to, I guess.
Oh, it's the company for that, yeah.
Oh, yeah, absolutely, yeah. It's their particular right. So when you call the transportation number for that carrier, they will transfer you to the organization that does that for that carrier. Thank you all very much.
Thank you all for joining us. We do have information there on the table. Those who are online, I want to encourage you to look up Pat Mayfield. Her information is on the church website. Her information is here on the screen. Give her a call for any questions that you may have. She will answer your call. And I've been knowing Pat for over 20 years. I trust her 100%. I would not bring anyone in that I myself don't trust. So I appreciate everyone that showed up today and pass on the information. Thank you all for coming out. Have safe travels home.